Radiation is a natural part of our daily lives. We are exposed to naturally occurring forms of radiation constantly. Sources of radiation include the soil that we stand on, the foods we eat, the air we breathe, and the light we're exposed to when we go outside. Examples of man-made sources of radiation include medical machinery, nuclear power plants, and nuclear weapons. Radioactive materials consist of atoms with unstable nuclei. These unstable nuclei attempt to transform themselves to a more stable form. In the process of transforming or decaying, they emit particulate radiation, which is minute particles, and electromagnetic radiation. One way of attempting to understand these complex terms is in the form of an analogy. If light waves at the beach can be thought of to represent a form of electromagnetic radiation, and sand particles at the beach represent a form of particulate radiation, one can go to the beach and be exposed to light rays, and if they're exposed for too long of a time, they may receive some damaging effects from that form of radiation. However, once they choose to leave the beach, they pose no risk to their new environments, and once again, they do not receive any ongoing source of radiation damage. Conversely, if you go to the beach and you're covered with sand particles, and sand particles are thought to represent radioactive particles or materials, you will receive radiation from those particles as long as they're in contact with your skin until they're removed. In addition, if you choose to leave the beach and sit in your car or interact with friends and family, you pose a risk of introducing these radioactive particles into a new environment. It's very important to draw a distinction between a nuclear bomb explosion and a dirty bomb explosion. A nuclear bomb detonation would result in a large amount of deaths over a widespread area. These deaths would result from blast injury, burns, and severe radiation effects. This is very different than the pattern of injury you would expect to see after a dirty bomb or radiation dispersion device explosion. The immediate health effects of a dirty bomb explosion would be the result of blast injury and burns. Unless you're in the immediate vicinity of the dirty bomb explosion, the radiation-related health effects would be negligible. The true effects of a dirty bomb would be the widespread fear and panic, as well as environmental contamination that would ensue. The health effects of radiation will be related to the dose rate and duration of radiation exposure. Low-level exposures will have negligible health risks, while a very high-level exposure could result in death over a period of hours to days. Significant ongoing exposure to radiation could increase your lifetime risk for developing certain types of cancer, such as thyroid cancers. It can also have an impact on future fertility rates and possibly cause birth defects. If a person is exposed to very high levels of radiation for an extended period of time, they can develop something called acute radiation syndrome. Patients usually succumb to acute radiation syndrome as the result of multiple body organ systems failing in concert with a severe infection that the body is unable to ward off.
There are 3 radiation protection principles that everyone should know. Maximize your distance from the source of radiation, minimize your time of exposure, and shield yourself from the source of radiation. These principles apply to all cases of radiation exposure, but are most important when faced with a high-level exposure, such as the detonation of a nuclear weapon. In general, staff caring for radioactive particle-contaminated patients are exposed to very low levels of radiation. Nevertheless, staff who have contact with these patients need to ensure their own safety by wearing appropriate personal protective equipment, commonly called PPE. The minimum standard for PPE when dealing with radioactive particle-contaminated patients is Level D protection. Ideally, patients who are contaminated with radioactive particles will be decontaminated before arriving at a hospital or clinic. It should be expected, however, that some patients will bypass the pre-hospital care system and arrive contaminated. Proper use of PPE and careful decontamination are key to patient and staff safety. The goals of decontamination are to prevent incorporation of radioactive materials into the body, reduce the radiation dose from contamination, and prevent the spread of radioactive materials. Wounds should be assumed to be contaminated and can be decontaminated by irrigation with sterile saline. Embedded particles should be removed. Ambulatory patients should be instructed to self-decontaminate.
One scenario care providers may encounter is a patient with what's called combined injuries, meaning a patient who potentially may have life-threatening injuries as the result of a blast injury or a burn, who also is radioactively contaminated. And care providers are going to have several thoughts. Number one, for the patient's welfare, what do I take care of first? Do I focus on decontaminating that patient, or do I attempt to take care of their life-threatening conventional injury first? The answer is take care of that patient's immediate life-threatening conventional injury first. Treat the blast effects, treat the burn injuries if they're life-threatening first. Once this is successfully accomplished, the focus can turn to decontamination. The second question is, by taking care of a patient's life-threatening injuries who still may be contaminated with radioactive material, am I putting myself at greater risk as a care provider? Well, the good news is, if you as a care provider take adequate precautions, meaning wear gloves, wear a gown, wear a face shield to protect your nose and your mouth, to prevent you from either becoming exposed to any radioactive particles or inhaling or ingesting them, you will not put yourself at any health risk by taking care of this patient. One final issue that is important for a care facility and care providers to remember is if there is a large-scale exposure to radiation, the amount of fear, confusion, and panic that will ensue in the affected population will be quite large. And care facilities need to staff appropriately so they could tend to the psychosocial needs of the affected population.
Following radiation exposure, care of life-threatening blast and burn injuries takes precedence over decontamination. If standard precautions are observed, it is unlikely that care providers will receive large doses of radiation from treating contaminated patients. Effective decontamination can remove most radioactive particles from externally contaminated patients. A dirty bomb explosion is unlikely to severely contaminate large numbers of people, but could create widespread fear.